So MindState's Design Labs is a portfolio company of Rand and Sam as well, in addition to Y Combinator, Initialized Capital, a number of other VCs and angel investors, including the founders of Neuralink, AngelList, Instacart, Coinbase, Twitch, a number of kind of visionary Silicon Valley entrepreneurs. My personal background is in biotech venture capital. So I worked for a $1 billion venture fund, working in primarily in deep tech, but across a wide variety of biotech investments and operations as well. And I started MindState Design Labs with Dr. Thomas Ray. He's our scientific founder. He's made seminal contributions to multiple areas of science. Not enough time to really get into his history today, but he's most famous for being the one who created the first instance of evolution by natural selection after life on Earth. This was the world's first artificial life program to evolve via natural selection. And he's been studying the phenomenology of psychedelics for the past couple decades. And we're taking this underlying tech and applying AI to psychedelics. So very much at the intersection of these fascinating topics here. A bit of an overview of how big this problem is for anyone not familiar. So psychedelic therapy is poised to transform mental health care, and mental health care is actually the largest market in all of life sciences. It dwarfs cancer, it dwarfs cardiovascular disease, and the economic burden goes well north of $1 trillion worldwide. In the United States alone, we spend $280 billion in direct healthcare spending. So that the scope of this problem is just enormous. And I'm sure anyone who's had family or friends or who have experienced mental health care problems yourself, you know that the alternatives that we have, SSRIs, antidepressants, the current forms of therapy just often don't work, or they have prohibitive side effects. And so the unmet need is just absolutely enormous. And very recently, psychedelics have experienced a renaissance. So psychedelics go back tens of thousands of years, at least, maybe longer. People have been using them for medical purposes, for religious purposes. But the Western world rediscovered psychedelics around the 19th and 20th centuries, when globalization resulted in the Western world making contact with some of these indigenous societies who were still using psychedelics. Of course, then the 1960s happened. So psychedelics were hailed in the 40s and 50s as the next great technology in psychology and psychiatry. People called psychedelics the equivalent to the microscope for microbiology, the equivalent to the telescope for astronomy. But unfortunately, psychedelics became entangled in the culture wars of that time, with lots of just widespread abuse of the drugs, involvement in the whole political situation that happened. And as a result, this very unique situation of an area of research being banned kind of happened. So there was really very little psychedelic research for many decades. All of a sudden then, around the 1990s, you begin to see a little bit of research being funded, and psychedelic molecules have been in a variety of clinical trials, then human trials for various mental and behavioral health disorders. And you can see in terms of the publications, there's just in the past few years, a enormous spike. And this is a result of these effect sizes in clinical trials. So to take MDMA as an example, ecstasy, commonly known as a party drug, but it's been applied to treatment-resistant PTSD. These are people who have had PTSD for decades, tried everything possible, nothing works. And with 3 sessions with MDMA, 67% of the patients no longer even qualified for the PTSD diagnosis. And you'll see similar results across different psychedelics. So as a result of these huge efficacy signals, all of a sudden you see enormous interest coming from academia, from industry. You see regulatory processes being opened up as government agencies start to pour funding and pay attention to this new breakthrough class of therapies. I'm not going to spend much time here, except to just say that we're trying to understand why psychedelics work. So every researcher has their favorite explanation for what's going on mechanistically. But the really interesting thing, and the reason psychedelics are so different from existing therapies, is that there's this psychological mechanism. So there's this altered state of consciousness that happens. In psychedelic therapy, you're bringing the patient into a supervised setting. So there's a therapist present or a doctor present. It's typically a very peaceful room with a couch where the patient lays down. They usually have eye coverings and music playing through headphones. That music specially designed to direct the patient inward. And in some way, the patient's state of consciousness fundamentally changes. Their sense of self, their sense of time, the memory function, one of these many fundamental constructs of perception for a very short amount of time changes. And it's that perspective shift, that new place to stand that the patient is able to take that allows us to get to the root cause of whatever the mental health disorder is. And so there's a lot of evidence for this. Let me take a quick example here. Again, let's just stay with MDMA. So if you take MDMA in a recreational setting, if you go to a concert, you're probably going to have a lot of fun, but it's not going to cure your PTSD. But in a therapeutic setting, if you are bringing the patients in with this intention of examining the trauma that's at the root of the diagnosis, the patient enters this state of mind that's termed the entactogenic state. That's the technical term. And it's characterized by overwhelming feelings of empathy, both for self and for others. And there's this overwhelming feeling that all is well with the world. And that results in this ability to safely contemplate mental pain, whatever it is, whatever that trauma was the patient can't face, the trauma that's giving them nightmares, that causes them to have great difficulty in day-to-day life. All of a sudden, the patient can sit with that, face it, talk through it, and very peacefully process that trauma because they're in this entactogenic state of mind. And there are many different states of mind that are similar. So the ego loss state of psilocybin and LSD is a famous one. Ego loss refers to the self construct disappearing. So the patient's awareness will continue to persist, but their concept of them existing as a separate entity from the rest of existence disappears. And this has been profoundly impactful in various therapeutic settings. So you can see some charts on the sides, the association of these states of consciousness with outcomes then in depression, anxiety, substance use disorder, certainly many other mental health disorders. That is what is the central mechanism here, this state of consciousness. So that's the background. What MindState Design Labs has done then is we've used our platform. This is our Osmanthus platform. It's an AI-based platform to design specific psychedelic states. So there are many different types of psychedelic states. Psychedelics are not this monolithic entity. You have a great variety of states here. The examples I like to give are NN-DMT. Joe Rogan is famous for championing this particular drug. It's the one where the patient would transition to a completely separate landscape. They become disconnected from the reality here and now. They typically encounter seemingly entities, so aliens, angels, elves, very bizarre experience. And I contrast that to other drugs like 5-MeO-DMT, which is completely different. There are no entities. There is no other place. Instead, it's what you call technically the classical introvertive mystical experience of oceanic boundlessness. So difficult to describe, but essentially all form and content dissolve. It's nothingness. It's a blissful void. I see lots of similarities here to various concepts of nirvana and samadhi and Eastern religion here. So different psychedelics do very different things, and we're trying to figure out why. And there's just no mechanistic understanding, or very little mechanistic understanding at this point. But what we've done in order to disentangle these relationships between the subjective experience, the conscious state, and then the underlying biochemical profile is we've combined those two data sets together. So these drugs have been in use for dozens of years. Sasha and Ann Shulgin, godparents of psychedelics, created these drugs, released the recipes to the world. People have been using these drugs in underground settings and then reporting on those experiences. So we have a massive amount of real world data on the state of consciousness. So we've gathered here 70,000 reports of psychedelic effects in humans, and we've synthesized that data with a giant database of psychedelic drug assays, looking at how each psychedelic interacts with the brain in a different way. And so we're combining AI together with natural history to figure out which biology is leading to which kinds of altered states of consciousness. So we've developed a large index of these conscious states. We've used various approaches using both AI and manual expertise here. It's the magic is really in the combination of natural language processing of those strip reports combined with quantitative calculations of the relationships to subjective experience and to biochemistry. And then it's the manual expertise. So our team's expertise on these states of consciousness. These are very ineffable kinds of experiences. Language has a difficult time grasping those experiences. And so our experts' ability to look at these fantastic metaphors and these drug-induced ravings and collapse them into discernible categories that can then be labeled and calculated is really the key here. And the goal of doing all of this, all of the NLP, all of the AI to calculate these relationships is so that we can then develop better psychedelics. So one thing we could do is more safely and reliably produce whichever therapeutic component is involved in an existing psychedelic state. So we talked about that entactogenic effect. We talked about the ego dissolution effect. There are many others with LSD, psilocybin, MDMA, the first generation psychedelics. But what excites us the most is the second possibility here, which is the possibility of creating new states of consciousness that are outside the scope of existing psychedelics. So that's what we're up to here at Mind State Design Labs.